Hello, everyone. I am Benjamin Day.
And I'm Jillian Mason.
And this is the Medicare for All podcast, the podcast for everybody who needs health care. So this is Jillian, you've been a guest a couple of times on the Medicare for All podcast, but this is like your inaugural legit podcast co-hosting experience as our new Director of Communications and Development for Healthcare Now. Welcome.
Who knew that I would go from being a beloved guest to being another loved host?
That's right. Anyone who wants to work for us, make sure you got to really pimp yourself out on the podcast first several times. It's the quick way to our hearts. So today's episode, we're going to be talking about the public option, which I was so happy to forget about for like a solid 10 years or so. Yeah. But it is back, and it's kind of a healthcare reform offered by, corporate Democrats as an alternative to Medicare for All that just will not die. And we are going to revisit this healthcare proposal.
Oh, boy. Yeah. So, Ben, do you want to talk a little bit more about like what the fuck a public option actually is?
No, I don't want to talk about it, but I will. So a public option is basically you take a public insurance plan like Medicare or Medicaid, which, Medicare covers seniors, people with disabilities. Medicaid covers low-income people of many different sort of categories. And you open it up to the public, but the public has to pay for that insurance plan. So it's from the patient's perspective, a public option insurance plan is very similar to a private insurance corporation, right? You pay your premium, you have a plan of what's covered and what's not, you have out-of-pocket costs, you have deductibles potentially, you have co-payments, maybe you have a limited network, maybe you have an out-of-pocket max. The plan is going to look very similar to a private insurance plan, but the insurance company is not a company, it's actually a state government or the federal government. Does that kind of make sense, Jillian?
Yeah, kind of. It doesn't sound that great, though.
Funny you should say that. But that's kind of the gist of it. And I guess to describe why it's being advocated for by a lot of Democrats in particular, I'd say mostly centrist Democrats. The idea is that if you have that, well, first of all, public insurance company plans are cheaper than private insurance plans. Sure. And that's partly because they don't waste money on tons of advertising. They don't waste money on lobbying. They don't do as much hard work to deny your coverage, your claims. They don't pay, these massive CEO salaries or executive salaries. So Medicare, for example, pays like just a little over 1% of all of their income on administrative costs. But you'll see private insurance companies where it's like 10%, 15%, 20%, even 30% of all your healthcare dollars go to administrative waste. So you would think that a public insurer might be able to cut out all that like excessive waste and offer you the same thing for a little bit less. That's the theory. So
all of this sounds very familiar.
Yeah, I know. It's almost as if we've been through this before. And it's funny because, we met each other during the Affordable Care Act fight way back in 2009, 2010. We were arrested at a Cigna action doing a civil disobedience. I think the only civil disobedience ever conducted in the suburb of Newton, which is an affluent suburb of Boston. There must have been like 100 police officers and, fewer protesters, I'd say.
As we were getting hauled away, I was like, to the police officer, very sarcastically, I was like, "Oh, I bet you get a lot of this here." And he was like, "Oh my God, no, this is the first time."
Never. They were so excited.
Oh my God, and they didn't know how to use the fingerprint machine too.
Wow. Yeah, we were the OG criminals in the suburb of Newton.
Apparently.
But do you remember, Jillian, because I know you got involved in activism basically for the first time during the Affordable Care Act fight, and it was because of your own struggles to access healthcare. Do you remember like the role the public option played during that old Affordable Care Act fight?
Yeah. So, I mean, you know, we were very young back then, by the way. We were very, very young. And
We
I
are
remember,
still very, very young. Okay, maybe not, but
I guess it depends on how old the listeners are, whether we hear
we're
them.
not going to ask.
That's fine. So yeah, I mean, I feel like we were really optimistic about it. I know I was. Like, I actually thought that this was going to be the gateway drug to socialism, right? And it was going to, like, you know, kind of just demonstrate why public health care is superior, right? It was going to compete with the private insurers, and it was going to show us all why public health care is superior, and America would fall in love with it. And they would say, you know what? Screw this. I want everything to be a public option. And then at that point, we would burn the health insurance companies to the ground, and we would win Medicare for all. And
As you were talking, I was thinking of Pete Buttigieg, who I think still believes this. I mean, it's not like this is totally something we don't talk about or deal with anymore. You know, just the Democratic primary debates that happened just a year or so ago, longer than a year ago. You remember Pete Buttigieg, the Medicare for all who want it. That is basically a rebranding of the public option, right? And he said exactly the same thing you just said, that, you know, if people want, if the government plan is better, people can choose it. And if it is superior and people want it, then it will just like gradually edge out the private insurers, and we'll effectively have Medicare for all, just like you were saying.
It was going to be really great.
Yeah. So, and, you know, I remember also, this is a little bit some sour grapes on our part here at Healthcare Now, but back then, only people of a certain age will remember this, and maybe even then you won't remember this, but there was a new organization, a big national organization with tens of millions of dollars launched, called Healthcare for America Now. Now, if that sounds familiar to you, it's because it's very close to our organization, Healthcare Now, but with an America sandwiched into the middle of it, because apparently we're not American enough. And Healthcare for America Now, it was a big union coalition, so there's a bunch of trade unions involved. One foundation with really deep pockets gave a lot of money to Healthcare for America Now. And they were basically created to run a public option campaign, to try and get a public option included in the Affordable Care Act. And also, incidentally, they were paid, I would also say, to kind of sideline Medicare for all. Their mission statement was, you know, basically excluded Medicare for all activists, single payer activists, as we were called back then. And they failed. Tens of millions of dollars, and they failed at that limited attempt. And as we all know, the public option was never included in the Affordable Care Act. So, Jillian, I mean, how do you feel about the public option like these days, compared to the rosy optimism gateway drug approach you had back then?
Much like the rest of my 30s, the public option has turned out to be a bit of a disappointment. And I'm not saying that I mean, a lot of great things came out of the fact that we were arrested to try to keep Cigna Healthcare from lobbying against the public option, but most of them have to do with the fact that we've been friends since then. And so I don't regret all the great activism we did around that and organizing. Sad disappointment. And I remember being very sad when they ended up, you know, cutting it out of the bill. I thought that was a tremendous loss. And then what was the compromise that they came up with? The co-op thing?
Yeah. So this is another thing people have completely forgotten about, which for a very good reason, it turns out. So back then, the House, then as in now, the House tended to be more progressive. So the House did include a public option in their version of the Affordable Care Act. But then when it came to the Senate, they were worried about a filibuster. And this was It was so weird. The Democrats actually had a filibuster-proof majority in the Senate. And then just as they were passing this bill, Ted Kennedy died, and he was the one vote margin. So he died, and then Massachusetts reelected a Republican, which was seen as a major blow to the Affordable Care Act, or kind of a refutation of the Affordable Care Act from the state that invented the whole model, the Massachusetts health reform that was kind of the model for the Affordable Care Act. So instead, there was a compromise with those who did not want the public option. Again, there was, as we see today, there was centrist Democrats who were kind of, at the time they were called Blue Dog Democrats. We still have a Blue Dog Democrat caucus, but we don't, it's not the force they used to be. The Blue Dogs were opposed to the public option. So instead, there was a compromise to allow states to create nonprofit co-op insurance plans. So it wouldn't be the government, wouldn't be big government getting into your health insurance, but it would instead be, big nonprofit or medium nonprofit getting, keeping all the savings to yourself. And these things were a complete catastrophe for the most part. I was going back looking over our old blog posts on Healthcare Now back when we used to have blog posts. And in 2014, when the Affordable Care Act kind of really launched all their shit, that's when the individual mandates started, when the Medicaid expansion started, the subsidies and the exchanges launched. There were 23 states with state co-ops launched. And just 2 years later, by 2016, 17 of them had failed, and only 6 were left. And the reasons they failed were a lot of the things we're going to start talking about when we start talking about the public option. So it might be worth touching very briefly on them. The first was these, as kind of new startup insurance plans, they didn't have much negotiating clout with hospitals. So hospitals would try to charge them really high prices, and they had no other alternative. They could either leave the hospitals out of their network, or they could pay just exorbitant prices to these hospitals, and that means they have to jack up their premiums and charge more for people who want to join the co-op, which defeats the whole purpose, right? The whole purpose was to have a cheaper plan where your money isn't going to profits. So that was, one problem. And then the other problem is that because this is, even though it's a public plan, or a nonprofit plan in this case, you are just competing on a market with all these other products. And so that means you have to make some difficult choices because, as we all know, insurance companies, they try to get their premiums as low as possible because that's basically the only thing people look at when they're purchasing an insurance plan. So
learned that one the hard way.
Yeah, no shit. We've all made, and this happens to a lot of people. If you have a workplace where you have multiple insurance plans available, you probably look at the lower premium one, and it's like, well, that makes the most sense. I'm relatively healthy until you're not. So the question is then, do you charge low premiums, but then you have really high deductibles, really high co-payments? Maybe you have limited networks. You're basically a shitty health insurance plan. Maybe you deny a lot of claims, really invest in reviewing claims and sending them back. Those are the ways that insurance companies keep their premiums down. And it's the same thing for a co-op or a public insurance plan. But I think you kind of expect that this public plan will be better, right? Will not be as evil.
I mean, that would be the point. And I think that that's something that we should just keep in mind throughout this entire discussion is that the reason that people came up with this idea of the public option was so it would be better.
Right, because we all know and hate private insurance, right? Right. But it turns out, if you want to be better, usually it's going to cost more, and that means you have a higher premium. That means people don't buy your plan anymore. And Jillian, you looked up kind of the present or more recent day data on the co-ops.
Yeah, it's not doing good.
No.
No, not doing so good. So it turns out that there are only 3 of the original. How many did you say there were originally?
23.
Of the 23, yeah, only 3 are left. And those are in Maine, Montana, Idaho, and Wyoming. And so one of them is in Montana, Idaho, and Wyoming, all 3
Right.
states. And then in Wisconsin.
Right.
So
So
if you are
only rural states surviving.
right, where they don't have people. I think that's probably the answer is that if you have fewer people, as opposed to like compared to cows or whatever, it's the people to cow ratio that makes a healthcare system.
Right. Well, the private insurers are trembling in their boots because those are very coveted markets, I'm sure.
Do you want to know how many people are enrolled or in 2019, 2020, which is this is more than it is now because that was back when the New Mexico plan was still running.
Okay.
You want to just guess how many people were enrolled in all 4 co-ops together?
I don't know. I'm thinking about those populations of the states. I mean, Wisconsin, Maine, they have some people. Let's say a million people.
135K.
Oh, okay. So that's like a very small village, or so this was a major Affordable Care Act provision. These co-ops launched in 23 states. Half the country basically had these co-ops. I know there's one in New York State, and now there's just 135,000. A handful of people are still using these, and the program is really limping along. What about Jillian? You were starting to talk about how you feel about the public option today. I mean, what do you see as like the pros and cons of a public option today, very briefly?
Oh, wow. After doing some research, right?
You can come up with pros. I know we're dumping on it a little bit here, but.
The pros would be, actually, I'm having a really hard time with it.
Okay. All right.
What do you think? What do you think the pros and cons are?
I mean, I have never been like opposed to the public option in principle, right? I think if you did it really well, like really, really well, and you did not have the government acting like a private insurance plan, if you let them set prices, basically like use Medicare prices, for example, and require all doctors and hospitals who use Medicare, who treat Medicare recipients to also accept public option recipients. If you do a lot of things right, I think it could have a moderately good impact. Maybe it'll be a tiny bit cheaper. But again, they would have to be not as evil as private insurers, which drives up your price a little bit. Maybe there would be a few people, again, it's going to be a small number of people who don't qualify for Medicaid. Maybe they make a little bit too much. They have to buy their insurance, and they could then afford a slightly, a public option plan. They couldn't afford a private option plan. It's not going to be that many people. I mean, the only way you get into a real impact maybe is if you let employers offer the public option to their employees. Then maybe you have a chance to reach a much broader audience. Because I think the biggest problem with the public option is that it's almost always offered through the exchanges in the state. So,
which aren't particularly popular, right?
No, they're not popular, and it's just not that many people. I mean, if you have a non-traditional job where you don't have a traditional employer who offers healthcare, this is where the exchanges can be really important for you. Independent contractors, artists, folks like that, people who are between work but have enough money to buy insurance.
Right.
But it's only, I looked up recently, I think only like 11 million people in the country buy plans through the state exchanges. And 11 million is nothing to sneeze at, but it's a big country of more than 300 million. And you can't fix our healthcare system. It's so weird that Joe Biden, Pete Buttigieg, and these folks were offering the public option as an alternative to Medicare for all, as if by giving a different option to these 11 million people, we can fix the healthcare system for all 300 plus million people, you know? So to me, that's the biggest downside, and just like the biggest, fake news, just like totally misleading bullshit about the public option narrative, if you're really only talking about this small segment.
I think also, one of the things that's so frustrating, right, is that when you say public option, right, it makes it sound like it's public.
Right.
but it's not, we know, in practice, right? So all of these state systems and also I think the plan that Biden proposed have been proposed to be administered by private health insurance companies. I think that's why I have a hard time naming pros,
right.
because we can't have nice things in this country, and we know that anything that leaves room for private insurers is going to eventually involve private insurers.
All right, I just thought of one more pro. I'll list one more pro to try and be fair, balanced, and honest. I remember back, especially during the Affordable Care Act fight, thinking that this might be a way to like divide and conquer the healthcare industry, to really to isolate the insurance industry. But I think that has all changed today, because especially if you go to, God, I hesitate even mentioning the name because I think we're like promoting our opposition, but the Partnership for America's Healthcare Future, which is the group that was formed, the healthcare industry group that was created to oppose Medicare for all. Their whole site is opposing Medicare for all and the public option, and they treat them exactly the same. And this coalition includes not only the insurance industry, but also the hospital industry. It includes both the for-profit and the nonprofit hospital industry. I think there's a bunch of CVS had been secretly donating millions and millions of dollars to this coalition. Pharma belongs to this coalition. So the public option has not succeeded in dividing and conquering. I thought maybe hospitals wouldn't hate it as much, but they assume that a public option will pay less than private insurance. So they actually don't want a public option either. And
right.
So all the political costs that we pay for Medicare for all, advocates of the public option also are paying those political costs, and they have the same enemies with the same deep pockets. And they've apparently decided to just throw all their money at both of these things, both Medicare for all and public option, and even pretend like they're the same thing, which is interesting. But
I think they're gaslighting us, actually.
Right.
I think that one of the reasons that the public option seemed so hopeful was because insurers were so angry about it at the time. But I don't know. All right. So this has been nice reminiscing, right? But the question is, why the hell are we sitting here in 2021 and talking? Yeah, I literally had to look at the date on my computer. In 2021, talking about this right now.
Well, it's not Pete Buttigieg, our illustrious, whatever he is. Transportations are. Okay, I thought he was the housing czar. That shows you how closely I've been following his career. Oh, God. Well, there's two reasons. One is that states have started implementing public option plans, which is really interesting. And I'm actually in favor of it because, as I said, I kind of feel like it's inadequate but mostly harmless alternative to Medicare for all. It's not an alternative to Medicare for all, because it's like Medicare for all solves major structural problems and helps millions of people, and just has massive sweeping impacts on our lives. And I feel like a public option helps very few people generally and has minor impacts on their lives. But I don't think it's usually a bad thing. So I'm actually glad to see some states moving ahead with it. And three states in particular, Washington State is the only state that has both passed and implemented a public option already. Nevada has recently passed a public option bill, but it doesn't go into effect until 2026. I don't know why why do legislators do this? Even from a selfish political standpoint, it was, we've been fighting for dental benefits in Medicare for this Build Back Better bill, and they're like, oh yeah, we'll give you dental benefits in 2028. It's like, it's not even know that there's an election cycle. There's 10 election cycles between then and there. And then the last state is Colorado, which has not yet passed a public option bill. But they've been debating it, and it's been gradually getting whittled away and made worse and worse and worse. But exactly as you predicted, Jillian, none of the, well, at least the ones that have passed, the Washington and the Nevada public option plans, are not as public as you might think they would be. Both of them, I mean, I think the insurance, the state is the insurer, so they're offering it, but they have contracted out administration of all of the public option plans to private insurance companies. So it's like, here's your Washington state public option provided by Blue Cross, or, you know.
That's like being like, your public library sponsored by Sprint.
Right.
Does Sprint even exist anymore? Probably not, but okay. Yeah. Yeah, no, totally. Here's a really funny story though. I mean, so one of the things that that this public option plan does, even though it doesn't actually eliminate private insurance, and in fact relies on private insurance, and, you know, drives a dump truck of money up to their door. But one thing it does do is it actually cuts the reimbursement rates for providers. And so, you know, I mean, basically like 160% of what Medicare, I'm sorry, it's going to be it's going to be 160% of what Medicare pays, right?
Which sounds good, but apparently is not.
It's not good enough. Not good enough for these providers.
Anyway, motherfuckers.
So in like 20 counties in Washington, you can't even buy into the public option plan because the hospitals have refused to participate.
Yeah. God. Yeah. This is the other thing. God, it's like, you know, I mean, with Medicare for All, hospitals and doctors can't opt out because it's the whole healthcare system, right? It's like either you're treating patients or you're not. You're treating zero patients. So this is not something we have to deal with in Medicare for All. That is kind of unique to let's launch a new plan. In a way, it's like in a way, a public option is like the opposite of Medicare for All, because we're trying to simplify the system and have fewer choices on the market and not have a market actually. Where as a public option is like, let's add another choice to the market and make it even more market-based. And Jillian, in addition to what you just said, which is like and this is the same thing that happened to the co-ops, you know, hospitals are either charging crazy rates or they won't accept it at all. I mean, I'm sure all those hospitals would accept it if they paid enough. And again, I only have the data as of May, but as of May in Washington, there were fewer than 2,000 people enrolled in the Washington public option plan.
That's a very small village.
putting even the failure of the co-ops to shame, right?
Yeah, that's harsh.
Yeah, and I think, you know, Washington is starting to try to tinker with their public option. So they've passed a new law to try and get all hospitals, I think, to participate in the plan. But again, it doesn't start until 2023. So it's, again, a couple of years off. But that's so far,
it's landed pandemics away, you know?
Yeah. Oh, God, I hope not.
Sorry.
But basically landed with a thud. So.
Yeah. And then, okay, so the punchline of all of this, right? You've got, they're not actually public. The hospitals hate them. People don't love them. And then finally, the whole point of this is to try to make healthcare cheaper. But what we learn is that premiums for the public option plans are actually higher than premiums for comparable commercial plans, which is so sad and depressing.
And this goes back to what we were saying at the beginning, which is like, if you're a public insurance plan, sort of ostensibly created by the legislature, run by the government, and you have a kind of public accountability, which is one of the things I like about Medicare for All, is like your whole healthcare system, if it's not working the way it should, there's accountability to the public, and you can lobby the governor, you can vote people out of office for if they're doing a bad job of it, all that stuff. Right. You can back insurgents who want to do something different. But this puts the public option in the position of like, are we going to be an evil insurance company or not? And my understanding is that the Washington public option does not have the same high deductibles that the private plans in the market do, and they have lower out-of-pocket caps, that's a good thing.
Yeah.
So they're like, we're not going to be as evil as these plans, but it means they have higher premiums, and that's that's exactly why probably so few people are enrolling in it. But as you say, it kind of defeats the whole purpose of why we wanted the public option plan in the first place.
Oh man! So ultimately, the state insurance exchange only sold 1,443 public option plans, and that's fewer than 1% of all of the plans on the exchange.
Right.
It's terrible. That's pathetic.
And bear in mind, 1% of the plans in the exchange, and then the exchange is, I don't know what percentage of all the people who have insurance in Washington, but it's going to be a pretty small number, right? It's going to be some small fraction. So we're like literally barely impacting anyone at all with this. So I'm interested. I do hope actually that Washington tries to make it better. I hope Nevada does a better job of it. But I have a feeling that the very best public option plan that states can carry out is not going to really address the reasons that you and I became Medicare for All advocates, like our healthcare horror stories, or anyone else in the country's horror stories. So given all this, and the fact that it's like literally playing out in the states, Jillian, why do you think like the public option has become such a central pillar of the Democrats' agenda? Certainly centrist Democrats, about half of the major candidates who ran for the president in the Democratic primaries. But also, I mean, if you look at these public option bills in Congress, they also have, Bernie Sanders is on there, Pramila Jayapal. Pretty much all the Medicare for All supporting legislators also support a public option plan. So why is this plan still persisting, and like, does it matter at all for the Medicare for All movement?
I mean, that's a really good question. I think obviously that it persists because it doesn't do anything to change the market model of healthcare, right? And ultimately, we know that even a lot of the most progressive Democrats who have voted for great things in the past and actually done good things for healthcare in the past, they tend to cling to the line that capitalism is going to improve healthcare. And I think that if you look at the way that people talk about the public option, it's always about how the public option is going to compete, right? In the marketplace, it's going to prove itself in the marketplace, right? And so I think that that's one thing. I think that like Democrats can say that they're fighting for access to healthcare while at the same time really, promising that they're not going to change anything.
Yeah, I think this probably calls for a very cynical view of what's going on.
I was going to say, like, you must have a more optimistic view, right?
No, not particularly. No. I mean, here's what I think. I think if there's legislators who are supporting a public option, but also fighting for Medicare for All over the long term, I have no issues with that whatsoever. I don't have any issues with that. Or like, let's fight to expand Medicaid in the states that haven't done it, and also fight for Medicare for All a little bit further down the road. Or, fighting, let's expand Medicare to include dental, vision, and hearing, and then we can get real Medicare for All down the road. I have no issue with people fighting for incremental expansion, as long as they're also doing the work of trying to win Medicare for All further down the road. Right, but we know this is not exactly how the public option is being used in politics, right?
I mean, yeah, it's like, yeah. I mean, I agree with you. Like, making incremental change is definitely important because, people are dying like right now. Like literally right now. And so we do need to do whatever we can right now. But I guess I've just lost hope that this is going to be our gateway drug. Yeah, but Washington State, prove me wrong. Nevada, prove me wrong. Colorado, prove me wrong.
Yeah, I think the moral of the story for this episode is choose your gateway drug very carefully. You want a good drug. You don't want some skanky ass, you don't want filler tucked into your gateway drug, like no dry basil, no
yeah. Yeah, that's right. Better gateway drugs. That's what I'm looking for.
Yeah, and I think that if I'm being totally honest, I think that the Bidens, Buttigieg's, and God, who else was it? I've already forgotten everyone's names from that primary. Everyone who was kind of running a public option. I mean, first of all, you could tell they were losing the fight to Medicare for All because they started branding all their public option shit using Medicare for All like sounding language. So it's like, oh, we've introduced the Medicare Extra for All bill. Here's the Medicare for America bill. Here's the Medicare for All Who Want It proposal. It was all kind of like, we know we've lost this fight. We're just going to steal your successful messaging and try and turn it against you. But also, I think, honestly, if you look at like the Republican Party, they don't even have a healthcare plan anymore.
Sure.
The repeal the Affordable Care Act thing was such a disaster that they literally have no alternative left, I think. And I think it's probably similar for centrist Democrats. There isn't really an alternative solution. They all claim to support universal health care. They're like, we all think health care is a right. We share your values. But they don't have a plan that actually makes it a right or establishes it as a right. So the public option is kind of like the fake, we'll throw this out there and it's somehow going to get us closer to or almost at universal health care. But we all know that that's sort of deceiving. So
it's the idea that won't die. It's the zombie Democrat healthcare plan.
So, and again, I'll just note before we wrap up here, very briefly, that we did see some stirrings earlier in the year that maybe congressional Democrats were starting to look at the public option again.
Right.
Chuck Schumer started soliciting feedback from other members of the Democratic members of the Senate, saying, what would you want a public option bill to look like? They requested that the Congressional Budget Office put together a whole report of like, what decisions do we have to make to develop a public option? But I think they totally abandoned it for Build Back Better because you can't pass it through the reconciliation process. So I don't think, at least with the current Congress, we're going to see a serious public option. But I think we'll continue to see it as like ballast for Democrats who don't want to support Medicare for All because they're afraid of alienating the healthcare industry, which is probably underlying most of this shit. So,
yeah, that is, wow. Sometimes these podcasts can end on a really depressing note.
Well, the non-depressing note is that we're organizing for a Medicare for All solution. Every short insight into our podcast planning process. For every day for the last 3 months, we've been like, should we do our next episode on the Build Back Better bill? As the Build Back Better bill has been dragged out longer and longer and longer and longer and longer. And we, again, this time was like, should we talk about the Build Back Better bill again? So we'll talk about it as soon as it's all kind of said and done. But we have been fighting, obviously, for Medicare expansion in this. And as soon as this shit is all done, we will have a Senate bill that Bernie Sanders is going to introduce after Build Back Better is done. We're going to shift to fighting for hearings on the House side. So there's going to be some exciting stuff happening that is not a public option.
Well, damn, that sounds amazing, Ben.
I'm looking forward to it. And I want to thank our podcast team also before we leave. Our podcast manager is Sarah Sang. Our writer for this episode was Lindsay Baish. Our show notes writer was Jerry Katz. And our audio editor was Sandra Felicia. If Sandra's computer is back up and working again. And if not, our audio editor will be Christian Brandt, who is our stepped in and may rescue the day. But hopefully, Sandra, fingers crossed, everything works out with your computer. Thanks, Jillian. It's great to have you on the podcast now.
Oh, yeah. We also want to thank Debbie Schwartz on Facebook and John Knapp on Facebook, jumping into the conversation. So, thanks for listening, folks.
Great comments. Yep. See y'all later.